Well, today on our Tech for Business podcast, I noticed a trending search topic about responding to healthcare incidents. I've brought Todd, our COO and CISO, and Nate, our Director of Cybersecurity, to talk a little bit more about it. I think my question seems a little silly, but why healthcare? Why is healthcare such a target compared to finance, compared to government?
I'll start, and the answer is it's the personal health information. It's the PHI that they want. So we can share some links, I'm sure, but statistically, the cost of some data that's out on the internet, credit card data, personal identifiable information, tends to go for about $1, $2 per record. But when you look at PHI, one of those statistics I saw was going for around $360 per record, so significantly more. And we can expand on this a little bit, but we were chatting about it a little bit earlier, and the comment says is your PHI never changes. So you can get a new credit card, but a lot of other stuff never changes. And once they get their hands on that type of data, they have the ability to do things that are rather alarming, right? I mean, everybody's probably got the Cialis spam messages, but when you start having PHI out there, it gets a lot more intense after that. And of course, that's the type of stuff that people are like, well, they know who I am. That has to be legitimate.
Yeah, that social engineering capability, once they have your, either home addresses, contact info, medical records, that's the stuff that is really quite concerning. Also, for things like your social security number that might be tied to it, you start putting together a lot of the pieces that you would need to be able to set up like full bank accounts and everything like that, right?
Mhm.
Or enroll in new credit, which, to Todd's point, a credit card, it's compromised, you just replace it, and that's dead. So that's the main concern there. And then I would say that when it comes to why healthcare specifically as well, I mentioned this during a healthcare board meeting once, and you could probably guess how this went after I tell you. But basically, I told these executives that healthcare is one of the least regulated industries when it comes to cybersecurity recommendations. If you're a healthcare executive, you're probably rolling your eyes at me a little bit. And one of the reasons why is there's a lot of regulations about the availability of that data and who can access it, and the kind of the tracking of all that the care records there. But what it does kind of fail to do is give out specific guidance on the cybersecurity controls to be able to protect the data long term, right? So if we go compare this to things like Ariel, you had mentioned the finance and the government, standards, is we do see the finance industry, they have auditors regularly coming into their environments and validating whether or not you've met those security controls that have been put in place by, whatever the governing body is for you. Or in the government sector, we saw that, the federal agencies, they had some security incidents, and then back in, I think it was 2020 or 2021 now, is the executive order came through to improve the nation's cybersecurity, which is a whole zero trust initiative. But they've been pushing cybersecurity in the government space since 2014, right? And so we're starting to see the healthcare industry seeing some of those regulations coming down the pipeline. Maybe I'll let Todd speak into that a little bit more, but high cost of patient records, low regulations to actually protect the data. It's just a good combination if you're a threat actor.
Yeah, I mean, quite frankly, the other piece of it, I think Nate covered that extremely well. But the other piece of it is there's this enormous uptick in attacks on healthcare, which I know is what we're getting at. But you're seeing some really high impact ones over the last couple of years with the Change Health and whatnot. But yeah, there is some legislation coming down. It's a bipartisan bill. It's referred to as the Healthcare Cybersecurity and Resiliency Act. It does have bipartisan support. So, I mean, I think at some point it seems likely that something will go through, but the way the government works, when that gets approved, how it gets ratified, no idea. But beyond that, the time it takes to implement typically takes a long time. So one of the key pieces that Nate touched on at the end there is the audit aspect. And that's really the accountability factor of we are actually going to make sure that you're doing the things you say. It's not just a self-assessment any longer or voluntary. Once that kicks into place, it's a totally different game. That's where the healthcare is different from a finance industry or federal government in particular, is there is somebody coming in and checking whether you're actually doing all the things that you said. And again, it's all becoming because it's such a problem. And of course, there's such a high value on that data.
So this is a silly question, but is the healthcare industry, are they just not getting audits, or is it just that there isn't enough like of a checklist in place to have these auditors follow? Does that make sense? Like, where is it falling apart?
Yeah, there's plenty of auditors in the healthcare industry, but it's specifically assessing the cybersecurity controls that's
Right.
lacking, right? You'll still have plenty of, audits with things like patient care and everything like that, right? Truly why you're doing healthcare, right, is to
Yeah.
to help protect the patients and give them a good quality of life. But again, there's no regulations that say you need to do X, Y, Z to be able to protect the network that houses either some of the cybersecurity, and that's where the audits kind of fall short.
Yeah, there is stuff out there. HIPAA exists. HIPAA's been around. I couldn't tell you, a long time. I guess I could have Googled that, but long time. But when it's coming in and it's giving its guidance, it's extremely broad, right? It says you must protect the data, and that's kind of it. I mean, there isn't this additional thing like what Nate's talking about. When you look at other industries, they get very, very specific. You will encrypt data at rest. You will encrypt data in transit. It's very, very specific. And then when you go back and you audit the control, does this exist? It's a yes, no thing. It's binary. There is no wishy-washy middle of the road. We may do that while we're trying or anything along those lines. It is very specific.
I mean, this is super interesting, and it might be a different podcast to talk a little bit about legislation and those changes. So I'd love to come a little bit back to this incident, because I did notice in my research as a marketer, a lot of people were searching, it's happened, now what do I do? Which is sad that we're at that point. When we're talking about incidents, what does that mean? And what does it mean to have a plan in place? And how does that plan change the outcome? That's a lot. That was a
It
lot.
is. I'll start with the first piece of it my assumption is people are searching it because it is happening. And if you look at statistic, it is. I mean, almost every organization, I think the last one I read was 60% of organizations do it, get hit by some sort of cyber attack. And our positioning at CIT is it's not a matter of if, it's when. And if that's true, if you don't have a plan, you're really not doing what you should as an organization. And you got to kind of have one. I mean, I almost threw out some terms in there that would make people really uncomfortable about negligence, and I kind of backed off of it. But you got to do it, and so I think that's really what's coming up. From my perspective, is you got to have a plan in place before it happens. If you didn't and it's happened, okay, we'll get into that in a second. But in my opinion, you got to have one. You know it's going to happen, even if it's a little thing like it looks like my email account looks like somebody might have got in there. If it's an investigation that turns out to be nothing, at least you had a plan. You knew what you're going to do about it. There is a maturity model that we follow with it, but first things first, build your plan, test your plan, review your plan, do tabletop exercises. We'll get into all those kinds of other things too. But again, the point of this, I think your question is very specific, is it happened, now what? And I'll start and I'll say the answer is call your cybersecurity insurance organization and call someone like CIT to get you rolling.
Yeah.
And then I'll let Nate dump into the playbook.
Yeah, one of the big ones is your insurance organization. And the reason why is typically when you have a major security incident, you can, I know we've done other podcasts about responding to major incidents. So some of the same stuff is going to apply here, is when you engage your incident or your insurance, what's going to happen is they're going to go bring in legal counsel and forensics firms and everything like that, and then they're going to start digging into things. Oftentimes, those third-party forensics firms don't go on site to help you. So if you're here in the Midwest, again, that's where CIT typically will help you out, where maybe you don't have the IT staff. but you have a forensics firm asking you to collect forensic artifacts, right? That's where my security team will come in and be able to help assist with that. With that being said, there's that legal counsel is going to be a big portion of this because when you get into an incident in the healthcare industry, you're going to have to report these incidents if they are patient records or medical info that's lost. And so the HHS does classify this out between under 500 records lost and over 500 records lost. So if you've lost over 500 records, you need to report that within 60 days of discovering the data breach. Under 500, there's different regulations with that, such as, within 60 days of the calendar year. And you can submit them all at once if you've had multiple incidents. But the big one that we're looking at is kind of that over 500 records. So if you exceed that 500 records, you need to notify, you need to start going down that path. There's something that a lot of the people in the security profession will call like kind of the HHS wall of shame, is those that have had over 500 records lost. You get put onto the HHS website and it says, here's how many records were lost, the state that they operated in, and the type of the cybersecurity incident, whether it's an email compromise or maybe they lost physical copies in a manila envelope or something like that. But sorry, you need to go down that route with your legal, and they'll help you navigate that, right? Other than that, yeah, once we start getting into the incident response plan, once forensics starts getting involved, they're going to go digging into your environment, trying to figure out what data was actually accessed. And this is a big consideration when you're trying to assess the criticality of this, is something might seem minor. Like let's say it was, oh yeah, someone's email got compromised. Well, in that email account, did you ever share PHI, right? Because there might be some Excel spreadsheet with 80,000 records that were stored, and someone was able to access it. So having good logging is critical. And then one of the other things that I'll just kind of end up with is in incident response, I'll just go kind of use that military terminology is slow is smooth and smooth is fast. And so what this means is you're going to feel like everything is taking forever to complete when it comes to forensics and incident response, but you need to do the due diligence on the forensics review to assess the full impact of the situation. And those forensics can take quite a while.
Yeah, there's a lot of other things that go into the nuance of it all as well. I wanted to highlight we kind of assume you have cybersecurity insurance, and quite frankly, for the most part, there's very few organizations that we run into that don't. We don't sell it, we don't promote it, we just feel it's a risk reducer, and so we recommend most organizations take a look at it. If you don't have it, it's going to be a lot more painful. The things that Nate's highlighting, the lack of legal, maybe you have legal, maybe you don't. The lack of their guidance through a situation like this does help. Sorry, I think I said the lack of it helps. It doesn't help. The lack of knowledge and that experience would not help. And then the same is true with the forensics. Given the opportunity, if you didn't have insurance, most organizations would say, well, I don't really need the forensics. Just kick the bad guys out, reset my system, give me a new password, and off I go. And we don't recommend that. To Nate's point is you don't really know how big the problem is until you really dig into the details. So the forensics is a very important piece of the puzzle. There is a recovery aspect of it too. So if you look at how things work, there just naturally is a chain that goes in there. And recovery is a massive portion of responding to an incident. Most organizations have done a really nice job over the last handful of years of making sure that they have good backups in place, and that's fantastic. A handful of years, you would see that they weren't what's referred to as immutable, meaning that you could get rid of current backups and delete others and whatnot. But more often than not, technology today makes that not really an option. So we don't run into it a whole lot. But what people do tend to miss in a lot of cases is that they've never really done the recovery point objective and recovery time objectives. And those are the two things that you need to know is How far back in time can I go and still have data and do business? And how long will it take me to recover? A lot of times we'll see a situation where they've got a single device that's holding 20 servers, which is fine. You've got your backup. That's fantastic. But when you start to do the recovery aspect of it, you can't recover 20 servers simultaneously. You can. It's just going to take you weeks to do it. And so you're going to have nothing up. And so you got to have a good plan that goes into that as well. So while we said incident response plans are big, disaster recovery plans are a huge piece of the puzzle as well.
Yeah. Yeah, when we do incident response, we tend to tell organizations the average downtime is 2 weeks if you have a major incident like ransomware.
And it almost always is.
And it almost always is. And it's surprising. There's people that will contend that saying, well, I have backups, right? Shouldn't I be able to just get operational? And then it falls back to Todd's point. Well, yeah, you overspec the appliance, so you can't virtualize your servers. So in incidents where we have seen proper spec backups, I've had organizations that got hit at 4 a.m. They noticed it around 6. They were fully virtualized and operational by 7:30, and the customers walked through the door at 8 a.m. and they never knew the difference, right? Because the backups were quickly accessible and capable of virtualizing an environment while the restores happened on the back end. Or the forensic collection was happening before the restores. So,
but to emphasize that took planning. You have to have the planning.
Yeah.
So,
sure.
But yeah, so we say the average downtime is 2 weeks. And so one of the things, because this whole podcast is about responding to healthcare, and if we know that the average downtime is potentially going to be 2 weeks, maybe longer in some cases, is identifying what the critical business processes and applications are in your environment is going to be critical. And really what this means is when your hospital or senior living area or dental practice or whoever is when you're down, can you still operate even on paper, right? So I know there's been some local hospitals around me where they were down and everyone started having to check in on pieces of paper, and then you have to go fill in the data afterwards, and making sure that the processes that contribute to patient care continue to operate successfully is going to be critical. A little bit before this, I was looking at a couple prior incidents because typically we think cybersecurity is just going to impact our network and the data, right? But in healthcare, it's different. It actually impacts lives as well. And so there have been cases that, I think the first time someone ever reported that someone potentially died due to a cybersecurity incident was in Germany back in 2020. Basically, hospital had ransomware, so they had to divert the ambulance over to a different hospital. That person ended up dying. Contested a little bit because you can't just purely say we had ransomware, you died, right? We know it's a little more nuanced than that, but there's also a study with the University of Minnesota that said between I'm going to say 2015 or 2016, 2015 or 2016, bear with me, between I think 2016 and 2021, there was like 40 to 60 people in Medicare that died due to some type of security incident. So there are real life implications to providing care for patients as well in these incidents. So that's why people get into healthcare, right? Just to help protect people. And so it's sad to see that that's being impacted because of this.
I think there's probably people listening who are saying, well, that's legally difficult to prove, but just reputationally, that can be hard to come back from. I can't remember exactly what it was, but we were talking before this podcast about how much money is spent after an incident for just marketing, just rebuilding who you are. That's some of those hidden costs that could be there that people don't think about or isn't probably covered in your insurance, just building yourself back.
Yeah, it is. It's definitely a massive cost. I think the statistic I saw was like 62% more spend on marketing to build your brand back up. It's kind of interesting to me I almost said funny, but it's not funny at all. It's interesting to me that when you look at cybersecurity attacks, to some degree, I feel like the world's getting a little numb to them. They're just like, well, it happened again, it happened again. But when it comes to healthcare, it's different, right? There is a trust level that goes with your insurance, not your insurance, I'm sorry, your health provider that people have built over a long period of time. And unfortunately, something like this really erodes the trust. And so now you do have to find a way to kind of build that back up. When I threw insurance in there, I'm just thinking about recent events. And it's funny, people do not trust their insurance company all that much, but the providers themselves, they do trust. And no offense to anybody in the insurance industry out there, but I just know the dissatisfaction is high currently.
Sure. I feel like you answered my few questions about sort of setting up a plan, having a plan, making sure you're having that disaster recovery, prioritizing your functions. So if it's a 2-week downtime, knowing what needs to come up first, engaging your cybersecurity professional, the team, calling your insurance, all of those things are important. So what advice would you give to improve their current plan?
Well, hopefully you have
It's
one, which is
hard. Yeah.
fantastic.
Yeah.
And the more specific it can be, the better. So there are different types of events out there. There's ransomware, there's email,
Mhm.
business email compromises, there's denial of services. So the more detail you can get around certain types of threats, the more effective it'll be. But testing the plan is probably the most important piece. And the way that we typically try to go to market with it is we just want you to have one. It doesn't have to be perfect the first time, but if you've got something to work with where you've got a call tree in it, you've got something which is really good. And then you start to mature it and say, okay, we're going to do a tabletop exercise. That the event happened. What are we going to do? And hopefully everybody says, I go grab my plan. Yay, we're winning. And then you start to do little things to tweak it, right? Do we have the right people on here? What happens if Nate is unavailable? Who do we go to then? And then you start to get a little bit more nuanced as you go through it. Um, Unfortunately, we've been through a lot of incidents over the years, and so we've got a very strong playbook. The benefit for that is our customers, when we do that testing, we can get very granular in saying this specific thing. We need to address this specific thing. We need to address, and so we can make that plan better and better. Beyond that, a couple other things that I'd throw out there is HHS does have some guidance out there. It's not the most robust yet, but it is getting better. It's free. They do offer some free cybersecurity training. You can access those types of things. CISA's doing a really nice job as well. So there are resources out there that organizations can kind of start to look over and say, how does this impact us? And how can we start to put our plans together? But the plan is definitely the place to start.
Yeah. The if I had one recommendation, it would be probably pointed more towards the healthcare administrators, is become interested in at least learning about some of these cybersecurity initiatives. I've been to healthcare conferences where, you walk in, everything's about, patient care and, true cost of care and everything, and the room is completely filled. As soon as you look at the breakout sessions, when it comes to things like cybersecurity, the room is almost empty, right? And so I'm kind of talking to people that right now that are maybe already engaged in this, but
Mhm.
if you are connected with other healthcare administrators that aren't, encourage them to take part in the things that maybe they aren't as comfortable in, right? Because we know that change cannot be made unless it starts at the top, right? And so, where does the budget come from? It's the administrators in your environment there. And so I would love to say multi-factor everything, put in things like EDR, right? These validate all the backups, which is critical because you already should have backups. So there's no cost to that except that your time for the most part, unless you need to like upgrade your system. But for the most part, admins really need to become ingrained in this, and I'm hopeful the industry will continue to see the changes and become more prevalent. So,
Yeah, I normally just let Nate finish, but I got to jump on that really quick. He made excellent points there. I've sat in those meetings too, and they're great. hospitals in particular, but a lot of healthcare have very strong incident response plans, but they're different than the cybersecurity incident response plans. And so the patient stuff, like Nate had mentioned, that stuff is rock solid. Those plans are amazing. They're extremely well thought out. They're practiced. The cybersecurity piece, I think what Nate's kind of getting at is cybersecurity is everybody's problem, and it really is. So having everybody, the more engaged, the better, is absolutely a critical point.
Mhm.
Yeah, I mean, I'll do our little selfish plug. We're probably preaching to the choir a little bit, so maybe send this podcast to someone that you know, to an admin, to a C-level, and just, let them get started on this journey.
Sorry. I'm not an influencer, but this sounds like the time to say like, comment, subscribe, right?
I love it. Yes.
Or share, like, comment, and share. Right?
Well, yeah, all the things. Oh man. Well, I want to give you a chance in case we didn't cover this. Is such a broad topic, and it's so important. If there's anything else you want to share, or any tools, specific tools or resources that you want to send people to about this topic, and it might be something we do part 2 on in the future. Anything else you'd like to share?
If you're looking, where do I start?
Mhm.
To maybe see how do I stand against some recommendations. There is the HHS 405D. I've used this before. So there are some general cybersecurity recommendations, and it does list out, here's the recommendations that like a small healthcare organization should have, and then, medium and a large size healthcare organization. So that would be a good spot to go take a look. Again, it's directly from HHS. But at least you have some type of checkbox where you can start evaluating the controls that you have.
Yeah, and mine would be, there is stuff out there, right? I mentioned CISA earlier, which was CISA. If you look at their best practices for healthcare, it'll pop up as your top hit, and there is good information in there. It's a good place to start of saying, it's typical stuff that you're trying to do is you need to start somewhere, and that's usually kind of doing some sort of observing or assessment, but it kind of walks you through all that type of stuff as well.
Just for the sake, because I just pulled it up on my other screen here, it specifically, the one that I was thinking of is the Health Industry Cybersecurity Practices. So it's the HICP. There's a document, and in that there's a matrix with those recommendations by employer size.
Perfect. We'll have all those links in the description if you want to check that out. Well, thank you so much, Nate and Todd, for joining us today. And if you like this, like, subscribe, send it on. We'd love to get some feedback. Thank you guys for joining us.
Thank you for joining us today. If you enjoyed this topic, please let us know. Like, subscribe, or reach out to us at info@cit-net.com, or head out to our website, cit-net.com/podcast. We'll be back next week with an all-new episode.